right, with no further ado, I will let you take it away, Nikki, and thank you so much.
Thank you. I am going to get the correct screen to share here. Just keeps giving you me. Hi.
You look great. We see the slide deck.
Oh, good. Thank you. Appreciate that.
Excellent.
All right. Thank you, Shannon. Good morning, everyone, and welcome to Applying for Wisconsin's Healthcare Programs. I'm so happy to be here with you all today. As Shannon mentioned, our session will end at 10:15 this morning, and then the next one begins at 10:30, but we should have plenty of time for questions. And as she mentioned, we will be taking those questions in the Q&A box, so you can type those right in there. And then I believe you can also upvote questions you most want answered. I have worked with Wisconsin's healthcare programs in one capacity or another for close to 24 years, but I will readily admit I still don't have all the answers. So Masiel is on the line with me to assist with your questions, but if there are any we can't answer between us or don't have time for, we'll be sure to get those answers to Shannon, and she can follow up with you all later. So, all right, let's go ahead and get started. Today's agenda includes the purpose of this training, program basics, how to apply for Wisconsin's healthcare programs, what to expect after applying, outcomes, and finally, resources. So let's start with the purpose of the training, which is to provide navigators, certified application counselors, partners, agents, and brokers with a basic understanding about how to apply for Wisconsin's healthcare coverage programs and what to expect throughout the application process. There are two other sessions I'll be presenting during this conference. Session 2, which is at 10:30 this morning, as Shannon said, focuses on eligibility rules for BadgerCare Plus. And then tomorrow I'll be presenting at 9 a.m. and that session will focus on eligibility rules for Medicaid for elderly, blind, or disabled individuals. Before we get into the presentation, I want to mention that there are still temporary rules in place for BadgerCare Plus policy during the COVID-19 federal public health emergency, including maintenance of eligibility for existing members, postponement of renewals, suspension of premiums, suspension of the treatment needs question requirement for childless adults, and addition of the elderly, blind, and disabled adult population to presumptive eligibility. Now, the information provided in this training today does not include these temporary rules. In this presentation, we wanted to provide you with the rules as they normally are and will be again, as far as we know, once the COVID-19 federal public health emergency ends. All right, let's move on to program basics. BadgerCare Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant women, and childless adults ages 19 through 64 who are not receiving Medicare. More details on BadgerCare Plus will be given in the Eligibility for BadgerCare Plus session. Medicaid for the elderly, blind, or disabled, also known as EBD Medicaid, covers adults age 65 and older, individuals who are blind, and individuals who are disabled. And again, more details on EBD Medicaid will be given in the Eligibility for EBD Medicaid session tomorrow. Most of Wisconsin's healthcare programs are administered by a network of county and tribal income maintenance, or IM, agencies. IM agencies process applications, they make eligibility decisions, and they issue benefits. All IM agencies use the CARES Worker Web Eligibility System, also known as CWW, to administer those benefits. All program rules are the same statewide, and applications are assigned based on where the applicant lives. Most county IM agencies are organized into 10 regional consortia, and you can find information on those consortia at the link shown on this slide. Milwaukee County IM is administered by the Wisconsin Department of Health Services, or DHS, through the Milwaukee Enrollment Services, also known as MILES. And then Menominee County IM is administered by the Menominee Indian Tribe of Wisconsin. When someone applies for healthcare coverage, the IM agency considers whether the person meets all the non-financial rules for healthcare programs. For example, is the person a US citizen, or does the person have a qualifying immigration status? And then also whether the person meets all the financial rules for the healthcare programs. For example, does a 67-year-old applicant have assets below the EBD Medicaid asset limit? And then based on the individual situation, which specific healthcare category is the most appropriate? For example, does the person qualify for BadgerCare Plus or for a type of EBD, elderly, blind, and disabled Medicaid? When someone applies for full benefit healthcare coverage in Wisconsin, they do not have to specify which program they're applying for. The CWW eligibility system will determine the best possible coverage for the applicant based on the program rules and the applicant's information that they've supplied. If someone is not eligible for BadgerCare Plus or EBD Medicaid, but might be eligible to enroll in a qualified health plan or QHP at the marketplace, their application will be transferred automatically to the marketplace. Any questions before we move on? Not seeing any, so. All right, now that we've gone over some of the program basics, let's take a look at applying for Wisconsin's healthcare programs. In addition to healthcare, BadgerCare Plus, and Medicaid, people can also apply for other programs and access, including food share, family planning only services, Wisconsin Shares Child Care Subsidy, Wisconsin Works, or also called W-2, job access loans, and emergency assistance. People can also start a request for assistance for the Women, Infants, and Children, or WIC program. Now, a person may use any of the methods shown on this slide to complete and submit an application, including applying online at access.wisconsin.wi.gov, applying in person or face-to-face, applying via phone, or applying by submitting a paper application. The filing date is the date a signed healthcare application is submitted to the IM agency. And in most cases, healthcare eligibility starts as of the first day of the month in which the application was filed, if they're eligible. Applicants can also request up to 3 months of backdating for most healthcare programs. Although please note that some pregnant women who are immigrants or inmates, as well as children with higher incomes, do not qualify for backdated coverage. IM agencies have 30 days from when they receive the application to determine eligibility. Everyone applying for or receiving BadgerCare Plus or Medicaid has the right to be treated with respect by IM agency staff, to have their civil rights upheld, to have their private information kept private, to get an application or have the application mailed on the same day it's asked for, to file an application right away, even if they're not in the correct office, and to get a decision about their application within 30 days of the day the agency receives it. Everyone applying for or receiving BadgerCare Plus or Medicaid also has some responsibilities. They're responsible for providing accurate information, for providing proof of information when requested, and for reporting changes as required by the program of assistance they're receiving. For more information on rights and responsibilities, you can see the Enrollment and Benefits Handbook, which is available at the link shown on this slide and which will probably also be put in the chat. And that brings us to our first poll question. Question 1 is, which is not an allowable way to submit an application? Is it A, completing an application by phone with an income maintenance worker? B, mailing in a paper application? C, completing an application online at access.wisconsin.gov? D, completing an application through online chat with an income maintenance worker? Or E, meeting face-to-face with an income maintenance worker to answer the application questions? And you should be able to answer that right on your screen in the poll. There's a poll that should be displaying right on your screen. So which is not an allowable way to submit an application?
Yes, and thank you, Nikki. I was remiss at the top that I did not discuss the polling questions. So the polling question should have popped up in your screen. The header to that box should say polls. And if you would answer the question via that mechanism rather than in the question and answer, that would be most helpful to our team. These sessions do require active participation. So it is expected that everybody submit an answer to the polling question. So please take a moment to do so. And I see 77% of you have participated, so that's great. We just have a few more to go. And then also, Nikki, we have a question. So after we get the answer to the polling question, maybe we can address that first question.
Sure, absolutely.
Thank you.
And
we'll leave the polling question open maybe for another 20 seconds. And please get your answer in. Your active participation is highly desired and required by the Office of the Commissioner of Insurance. So please submit a response to the polling question. And we'll get you an answer shortly.
And Shannon, I don't think I can see when we're at 100%. So I think you're going to have to just let me know that when you're ready for me to give the answer.
I will let you know. We never seem to arrive at 100% on these things, but we are at 90%. So we'll give people 10 more seconds to get a response in, and then Nikki, you can share the answer.
Okay. All right. So the correct answer is D. Access does not have an online chat feature for people to communicate directly with an income maintenance worker. Applicants and members with questions can call their income maintenance agency or member services. So D was the correct answer. And let me take a look at that question in the question and answers. It says right to apply even if they're in the wrong office. Does this apply to calling into the wrong office? Can an application start in a different consortium? So that applies to calling or showing up in whichever office. They should be allowed to, at minimum, set a filing date, no matter if they're in the wrong office or have called the wrong agency or not. So setting that filing date is most important so that they can get their eligibility as soon as possible. So we never want to turn someone away. We want to at least set their filing date. Does that answer your question? All right. Okay. Any other questions before we move on to the methods of applying? All right, let's talk about those different methods of applying for healthcare. We'll start with Access, which allows members to apply for and manage their state of Wisconsin benefits and programs in one place at any time. The Access website is, as shown on this slide, access.wi.gov. Access connects members to the help they need when they need it. One of the Access functions, titled See If You Can Get Help, is a short screening tool to find out which benefits someone might be able to get. No access login is needed for that tool. Another access function is Apply for Benefits, which allows applicants to apply online for healthcare coverage, food share, childcare, Wisconsin Works, also known as W-2, emergency assistance or EA, which is different than emergency services for healthcare, and job access loans or JALs. Applicants can also complete a pre-application for Women, Infants, and Children program or WIC, and this does take them outside of the Apply for Benefits module, and their pre-application information is sent to the WIC clinic in their area. Now, in some cases, applicants may be able to get an immediate eligibility decision for healthcare, and that is called real-time eligibility. An access account also allows members to check benefits, renew benefits, pay ongoing premiums, report changes, view notices, and perform other management functions. To perform these benefit management functions, members do need to create, authenticate, and use an access account. As a note, members can also check their benefits and do some benefit management functions on the My Access mobile app. More information is going to be given about My Access a little bit later in this presentation. All access pages are available in Spanish by clicking the Espanol link, and users are able to view help text for questions that may need additional explanation. The Access training site can be used to teach people how to use Access. This site cannot be used to apply for benefits. The web address for the training site is trn.access.wisconsin.gov. Any questions about Access before we move on to the other methods of applying? Okay. Will we talk about JAL? Not familiar. Job access loans? No, we won't be talking about job access loans today. All right. Walk-in and telephone applications are also ways in which applicants can apply for healthcare. And individuals have the option to apply in person at their county or tribal agency. They may also apply by phone. Each consortium has a central phone number for taking applications and other customer services. And you can find phone numbers and office locations at the link shown on this slide, which will also likely be put into the chat box. And the last method of applying for healthcare is that mail-in application. Because they have different eligibility rules, BadgerCare Plus and EBD Medicaid have different application forms. The BadgerCare Plus mail-in application, Form F10182, is available at the first link shown on this slide, and the EBD Medicaid mail-in application, Form F10101, is available at the second link shown on this slide. However, I want to mention that either application can be used to make a request for full benefit health coverage. So, if they send in the wrong application, their filing date will still be set. The application will still be processed. It's just that the IM agency may need additional information that wasn't on the application that the member sent in. So, all right. That brings us to our next poll question. Question 2. Which of the following actions can a person not do in Access? A, request a fair hearing to appeal a denial of benefits. B, check their existing benefit enrollment status. C, view electronic notices about their benefits, or D, report changes to their household situation. Which of these actions can a person not do in Access? We'll give you some time to answer that. And we're just going to give everyone a little bit more time. All right. Looks like most of you have come up with the correct answer. Wonderful. The correct answer is A, request a fair hearing to appeal a denial of benefits. If an applicant or member wants to request a fair hearing in order to appeal a negative action taken on their application or case, they must submit their request to the Division of Hearings and Appeals, and we'll have more information on that a little bit later in this presentation. Any questions about the methods of applying before we move on? Okay. That brings us to what to expect after filing an application. So let's start with some information about who will be processing submitted applications. Applications submitted via Access may include programs that are not processed by income maintenance agency workers. Income maintenance agency workers process applications for healthcare, food share, and childcare. Programs processed by other agencies include Wisconsin Works, or W-2, Emergency Assistance, or EA, Job Access Loans, or JALs, and Women, Infants, and Children Program, or WIC, which is why we won't be discussing JALs today. Those applications are processed by other agencies. So information in this presentation today is specific to healthcare programs processed by income maintenance agency workers. So those applications for healthcare, food share, and childcare. Before making a decision about eligibility, IM agencies must verify the information the applicant has reported. In many cases, IM agencies can use data exchanges to verify the following information: citizenship, immigration status, earnings from a job, Wisconsin unemployment benefits, Social Security, supplemental security income, or SSI, and child support payments. In other cases, applicants will be asked to submit proof of what they've reported. Proof can be submitted by fax, mail, in person, or through Access or My Access. So we do encourage people to use Access and My Access if they can, because doing so submits the document to income maintenance right away. And My Access even allows people to use their cell phone to take a picture of a paper document and submit it. No scanner is needed. Now, the agency will send a verification checklist, or VCL, called a Notice of Proof Needed, listing the items that are needed and the date they're due by. A VCL will also be sent if the agency is missing information needed to make a decision and will include the date by which the agency needs the information. If an applicant doesn't provide the requested verification or information by the due date listed on the VCL, the application will be denied. Remember, we said that IM workers had 30 days to process applications. So that due date is the 30th day. And if they don't get the verification by the 30th day, they have to make a decision on the application. They would have to deny if the verification was required to determine the eligibility for that program. So let's talk about that verification checklist, or VCL. It lists verification requirements for BadgerCare Plus or Medicaid, as well as food share if applicable. It provides the due dates for providing the information requested. It contains specific examples of documents that are needed, and it includes a document tracking sheet, which can be used to submit the documents. The VCL, again called the Notice of Proof Needed, informs the applicant or member that the items we need proof of are listed with examples and instructions, and that failure to provide proof by the due date will result in benefits being denied, decreased, or ended. It also mentions using the document tracking sheet, which is located at the end of the notice, to make sure their benefits get processed as quickly as possible. Next, it lists the program or programs of assistance verification is needed for, along with the due date of the verification and the contact information for the consortium that's processing the application. Then the proof needed section displays listing the proof that's needed, the name of the individual proof is needed for, examples of ways to give proof, which program or programs the proof is needed for, and the due date for submission. I do also want to mention that that verification checklist, or that notice of proof needed, will be sent by mail. And if they have signed up for Access or My Access, they absolutely can also see that notice in Access and My Access. Any questions about verification or providing verification or how it's requested before we move on? I want to give a couple minutes here or a little bit anyway, see if there's any questions.
Yeah, let's give folks a couple minutes to ask questions. And I also just want to highlight that this is an area where enrollment assisters are really helpful for people who are applying for programs. When people get this letter or get this notice, sometimes they understand it and are able to submit the documentation just fine, but other times they really need some support in gathering the documentation they need and getting it in to the consortia. So this is an area where enrollment assisters, such as navigators and certified application counselors, agents and brokers, can really provide a valuable service to consumers in helping them get the documentation they need to complete their application.
All right. No questions before we move on? Oh, can you explain how an applicant can trigger the use of best available information? So are you talking about when they're not able to provide the verification, I'm assuming? So if they are not able to provide the verification, they should be contacting their IM worker because, okay, thanks, Mike. Because the IM worker can also and is supposed to assist the member in getting the verification if they're not able to get it for some reason. So that would be a conversation they would have with the IM worker or the IM consortia through that, telephone, or if they came in person, whichever. They would be doing everything possible to get that verification first. And then if the member isn't able to get it, if the worker isn't even able to get it, then they should be using best available information. And certainly the member can say, you know, if you're not even able to get the verification, can you use best information available? But that is what the IM worker should be doing if they're, you know, if they've both tried to get the verification and they haven't been able to. What if an applicant receives the VCL after the due date? Well, they shouldn't be receiving the VCL after the due date, although I know mailing times have been extended. I would recommend if they're receiving that VCL after the due date that they contact the IM worker. They use the telephone number, or you know, if they need to go in person, whichever, and discuss that with the worker. The verification date can be extended up to 10 days, but that is the longest possible. So basically that 30 days plus an additional 10 days is the longest possible that an IM worker can let an application go before they confirm it. And if they haven't received the verification, they have to confirm it as failed if they don't have the verification they need. So, however, I do want to say that, you know, at that point, they could be asking to reapply. And if it's within 30 days of getting that denial, they wouldn't have to go through the whole process again. You know, they wouldn't have to sign another application. So there are ways to make it a little bit easier on the member. So they should be discussing that with their worker or agency contact. Is a social security number needed to create an access account? For example, mixed status family, mom applies for child. A social security number is not required to create the access account itself. A social security number would need to be provided for the application, of course, but not to create the access account itself.
And Nikki, can we just clarify that the social security number is only needed for the person for which the benefits will be for? So if
Yes.
Mom is doing an application for, say, daughter, and daughter only, it is only daughter's social security number that will be requested. Nothing will be requested from Mom in terms of her identity in that way. Is that right, Nikki?
The application will probably ask, I mean, if we're looking at BadgerCare Plus, we're looking at the whole family's income probably. We'll talk more about that in a little bit. So yes, they may still be requesting Mom's social security number during the application process, but it won't be required to create an access account. So
right, but if Mom doesn't have a social security number, that's okay.
Yeah. I mean, if she doesn't have one, she doesn't have one. So yeah, the application can be submitted without a social security number. Yes.
There we go. Sorry. I did miss what I said, was very unclear. So thank you for clarifying.
No problem. All right. When we assist in applications, we see confidential information. We'll go over best practices for protecting that information. That is not something we will be going over. That is something you should probably talk with whoever you are working with on your end about how to keep that information private. Do you have any input on that, Shannon?
Yeah, I can share. For certified application counselors and navigators, there is federal training required, which is on something called the CMS Enterprise Portal. And there is parts of that training that do go over best practices for protecting sensitive information. It's a good and important question. And then also, you know, what Nikki shared, definitely going back to your organization. Many of you are at hospitals or health clinics, right? To talk about what are the best practices for protecting sensitive information.
All right. Any other questions before we move on? Okay. So now let's talk about possible outcomes of the application. After the IM agency has verified the information reported on the application, the agency will make a decision about eligibility. The applicant will receive a letter telling them if the benefits are approved or denied, and that is called a notice of decision. The notice of decision includes the following information. It includes a summary, and that section lists the benefits that have been approved and or denied, as well as contact information for the IM agency. It includes benefit details, including who is enrolled, dates they're enrolled, who is not enrolled, and if not enrolled, the reasons why. It also includes household income and deductions. These sections list the income and deductions on file for the household, and members should check to make sure that that information is correct when they receive their notice of decision. And then it also includes how we counted the income. So this section lists the amounts and limits that were used to decide whether the member is eligible or not. Additionally, the notice of decision includes reporting rules. So if benefits have been approved, this section tells members what changes need to be reported to the local agency and when. Now, it's very important to note that members must contact their IM agency to report changes in access, or in their case, changes reported to member services, which is the phone number on the Forward Health Card, or the HMO, are not shared with the IM agency. So if they are required to report a change on their case, they need to report that change to the IM agency. They may also report it to their HMO, but the HMO doesn't share that information, and neither does member services. So looks like we have a question. Is child support taken into consideration as income in the household? We'll go over that when we talk about BadgerCare Plus and EBD Medicaid. So great question. But we'll talk about that when we're talking about eligibility. And then what about linking a case once an application was started via telephone? What information is needed for access? So if they've started an application via telephone, like just set their filing date, you mean, but then now they want to submit the application online?
We'll take that back.
Okay. All right. Also want to mention that key contacts are listed on the notice of decision. That section provides information about who members should contact with questions, and fair hearing information is given. So the last page of the notice provides information about fair hearings, including the date by which a fair hearing must be requested and how to ask for a fair hearing. So if benefits are denied, reduced, or ended, and the applicant or member believes the IM agency made a mistake, they can contact the IM agency directly to discuss the situation and try to find a resolution. If the applicant or member would like to request a fair hearing, they can ask the agency for help in requesting a fair hearing, or they can also just directly contact the Division of Hearings and Appeals to request a fair hearing. At that hearing, a hearing officer will hear from the applicant or member and the agency to find out if the decision was right or wrong, and require the agency to take action as appropriate. And then after the hearing officer will send a written decision to the individual and the agency. And that brings us to our next poll question. Question 3, what is not included with the notice of decision? A list of who is a list of who is in the household, who in the household is enrolled in benefits. B, the reporting rules stating what types of information the household must report to the income maintenance agency within a certain time period. C, information about how to request a fair hearing. D, a list of the income and deductions used to determine eligibility. Or E, permanent forward health cards for members eligible for BadgerCare Plus or Medicaid. So what is not included in the notice of decision? We'll give you some time to answer that. Give just a little bit more time here. About 20 more seconds. All right, so the correct answer is E, permanent forward health cards for members eligible for BadgerCare Plus or Medicaid. Looks like we had about 88% choose E, so great job. Permanent plastic forward health cards are not included with the notice of decision. If a person is a new member, their forward health card will be mailed to them separately. New forward health cards will not automatically be mailed to people who were previously enrolled in BadgerCare Plus or Medicaid, though. Those members can use their old card if they still have it. So members should be encouraged to keep their cards even if they lose benefits. However, if they do need a new card, they can contact member services to request one. And we're going to talk about that in just a bit. All right. Any questions before we move on? Okay. Let's talk about receiving services. So each eligible person will receive a forward health card if they haven't received one in the past, which should be shared with providers when services are requested. If someone has received a forward health card in the past, they will not get a new one. So members should be encouraged to keep their card in a safe place, even if they're no longer eligible for health care. And members can request a new card by calling member services at 1-800-362-3002. Covered services are listed in the Enrollment and Benefits Handbook, which can be accessed at the link shown on this slide and which will likely also be put in the chat. And some services may require prior authorization. The provider will request authorization on the member's behalf. For some services, members may be required to pay a copayment or copay. However, monthly premiums and copays for BadgerCare Plus or Medicaid card services must not be more than 5% of their household income. The 5% cost share limit applies to members eligible for BadgerCare Plus, SSI Medicaid, and most EBD Medicaid programs. Members enrolled in MAP and Senior Care do not have a cost sharing limit. This limit does not apply to deductibles, patient liability for institutional Medicaid, or cost sharing for home and community-based waiver services. For members that are subject to the cost sharing limit, a copay limit will be set on a monthly basis. Now, the copay limit is based on the assistance group's income used to determine eligibility. And copays are tracked based on copays the individual has incurred, not the amount they actually paid out of pocket. Since, I mean, they might have incurred more than they've actually been able to pay. So, you know, the provider may allow them to charge a copayment, or they may just not have been able to pay a copay. So it's based on the copays they've incurred. Most copays range from 50 cents to $3. And providers may make a reasonable effort to collect the copay, but they may not refuse services if the member does not pay. For questions about covered services and for help with finding a BadgerCare Plus or Medicaid provider, individuals can contact member services at 1-800-362-3002. So let's talk about renewals next. Members must renew their eligibility every year. The renewal process can be completed online, by phone, in person, or by mail. Members will receive a letter with instructions for completing the renewal 45 days prior to the end of their 12-month certification period. In some cases, eligibility can be renewed through an administrative renewal. So an administrative renewal occurs when the IM agency is able to verify all information through data exchanges. However, members will be sent a summary of their case after a successful administrative renewal, and they would be required to review that and report any changes to the agency within 30 days. As a reminder, these renewal policies are those under regular rules, not during the COVID-19 public health emergency, temporary rules that are still currently in place. And that brings us to our last poll question, which we'll do before we answer the question in the chat. So question 4 is, under regular rules, which of the following is false? And regular rules mean when the COVID-19 public health emergency temporary rules are not in effect. Which one is false? A, members will receive a letter with instructions for completing a renewal. B, members always need to submit a renewal form to their income maintenance agency as part of completing their renewal. C, the renewal process can be completed by phone, by mail, in person, or online. Or D, members must renew their eligibility every year. So which of those statements is false? We'll give you time to do that. We're going to go ahead and give you about 30 more seconds. All right. And the correct answer is B. B is the false statement. Income maintenance agencies are able to renew eligibility administratively for some cases. That means the member does not need to submit a renewal form. If an administrative renewal is possible, they would just be required to review the summary that's sent to them and report any changes. All right. I'm going to go to the questions. But to clarify, did you say that if someone does not have their copay, provider cannot refuse services? Yes, that is what I said. That is correct. Is an interview needed when renewing? Depends on the program of assistance they're receiving. If it's healthcare only, an interview is not required. I thought there was another question up there, but I may have. All right. Any other questions before we move on? All right, that brings us to our additional resources. Members with an authenticated MyAccess account can download the MyAccess mobile app to do the following. See the programs the member is enrolled in, including HMO contact information and when the next renewal is due in Check Your Benefits. Be reminded of actions the member needs to take or documents the member needs to submit in Get Reminders. Take photos of and submit proof at any time, then check its status in real time in Submit Documents. And receive a pop-up module approximately every 6 months that will display and allow them to confirm or update their existing home address, mailing address, and phone numbers on file. The MyAccess mobile app can be downloaded for free at the App Store or Google Play. Another resource for members is a guide to applying, which is available at the link shown on this slide and will likely be put in the chat. It includes information about who can enroll, how to apply, required verification, benefits and services available, rights and program rules, and fair hearings. The Enrollment and Benefits Handbook, available at the link shown on this slide, is sent to all applicants and members and includes information about benefits and services available, program rules, required verification, change reporting requirements, covered services and prior authorizations, rights and program rules, and fair hearings. You can find information about IM agencies, which determine eligibility for BadgerCare Plus and Medicaid, at the first link shown on this slide, and I believe we gave that link before as well. And then you can find information about Aging and Disability Resource Centers, which, among other things, provides enrollment counseling for home and community-based waiver programs at the second link shown on this slide. Member services, whose staff can answer general member questions, information about covered services, and help with finding a local IM agency, can be contacted by calling 1-800-362-3002, and this is the same number that's on the Forward Health card. And a fair hearing can be requested through the Division of Hearings and Appeals. Their telephone number is 608-266-7709, and more information can be found at the link shown on this slide for hearings and appeals. Some resources for partners includes information about Wisconsin's healthcare programs, including member fact sheets, which can be found at the first link shown on this slide. Information for partners in Southeast Wisconsin, which can be found at the second link shown on this slide. And then there are partner demonstration videos that can be accessed on the Wisconsin Medicaid and Food Share Partner Resources for Eligibility and Enrollment Vimeo site. And that's the third link shown on this slide. All right, that does complete the presentation. However, we do have time left in our session. So if you have additional questions about the information presented in this session, go ahead and add them to the Q&A right now. And we will take a look. What happens if they can't pay copays for meds? I don't know the answer to that question. I don't know if Masiel, do you know the answer to that question?
There's several answers with different situations.
Okay.
So I would encourage you with the individual with that question to email the DHS Forward Health Partner inbox. We can take a look at that situation and let you know. Like I said, there's so many different scenarios that I don't want to confuse everybody on the call.
Okay, thanks, Masiel. Any other questions?
Thank you so much, Nikki, and thank you, Masiel. We'll give people a little more time to put their questions in. I know at the end of a presentation, they always take a little while.
Yeah.
So we'll just sit tight. We know there are questions. As you think of them, please, put them in, and we'll give everybody a minute to allow that to happen.
Yep, we still have time.
I'm also working to get that. Oh, you've got the Forward Health Partners inbox right up. Okay.
Oh, yeah.
Great.
Yep. I was going to mention it before we were done, after we answer all our questions, but just to let you know, for any new questions you might have that you think of afterwards, related to applying for Wisconsin's healthcare programs, you can direct those to the Forward Health Partner inbox at the email shown on this slide. We are always happy to help out with those questions, and Masiel and another member of our team kind of triage those and get back to everyone. So they do a wonderful job at providing answers to those questions. So
yes, we work definitely very closely with our policy team to vet those answers and responses to make sure you get the accurate information on your question. I just wanted to follow up on a question that we had previously related to Social Security numbers, needing those for applications and for benefits. Just wanted to let the group know that an individual who is applying for benefits doesn't necessarily need to have a Social Security number. They can be applying for the prenatal care coverage for the pregnancy, and the individual is either an immigrant or a non-qualifying individual to get BadgerCare Plus. They don't necessarily have to have a Social Security number, and they are assigned a personal identification number, which we call the PIN, that they can go ahead and navigate the access system and things of that nature. So yes, you do need to be a qualifying, resident or BadgerCare Plus to receive BadgerCare Plus, but you don't necessarily have to have a Social Security number. We have mechanisms in place to be able to identify those individuals within the system and such. So
yeah, and we will be talking about that a little bit more during the BadgerCare Plus presentation at 10:30. Yeah, it's very important to know that you're not required to have a Social Security number to apply for benefits. That is not a requirement.
Mm-hmm.
You're likely going to be asked for your Social Security number, but you are not required to have one. So you may be required to be a citizen or a qualifying immigrant, but to be eligible for a full benefit Medicaid program. But again, we will be discussing that in more detail during our BadgerCare Plus presentation. Any other questions, or?
I am not seeing additional questions come in. So I think everyone can leave their their Zoom open. Presenters can turn off their video and mute their microphones. We will just leave this session open. We will return at 10:30. So come back to your computers by 10:30 and we will do the next session with our same wonderful presenters from the Department of Health Services. And so take a break, meet your needs, get some coffee, do what you need to do, and come back to your screens at 10:30 for the next session. Thank you all.
Thank you.
Okay, welcome back, everyone. Hope you have all returned to your computers and are ready for the next part of our training. I want to preview for everyone that this session, we would like you to have a handout available to look at. That handout is called the BadgerCare, Forming a BadgerCare Plus Magi Group, and it is located on our conference homepage, which I have put in the chat. If you haven't had the opportunity to print that handout, if you have two screens, go ahead and open it up on a second screen so that you can look at it when we get to that point in our second session of the morning. So thank you all for coming back. We will have our second session now, and that will be on BadgerCare eligibility, and Nikki will be presenting.
Thank you, Shannon. I'll go ahead and share my screen. You can let me know if it's coming through.
Looks good.
It looks great.
Wonderful. Thank you. Okay. Welcome back, everybody, to session 2, BadgerCare Plus eligibility rules. This session does end at noon, but just like with our first one, we're gonna have plenty of time for questions. You can continue to use that Q&A box and we will answer those as best we can. So let's go ahead and get started. All right. I just want to make sure it doesn't appear that the yellow box is around my.
You're presenting, you look good.
Okay, just checking. All right, today's agenda includes the purpose of this training, an overview of BadgerCare Plus, including the non-financial and financial rules, and finally resources. The purpose of this training is to provide navigators, certified application counselors, partners, agents, and brokers with an overview of the eligibility rules for BadgerCare Plus. As a reminder, our first session this morning was on applying for Wisconsin's healthcare programs, and tomorrow's 9 a.m. session will focus on eligibility rules for elderly, blind, or disabled Medicaid. So let's take a look at an overview of BadgerCare Plus eligibility rules first. Before we do, please keep in mind that this training provides an overview only of the eligibility factors that will be considered for BadgerCare Plus. It's not intended as a training on how to determine eligibility. Only income maintenance or IM agencies can determine eligibility for most programs. The policies described in this training are subject to change, and updates are available at the links shown on this screen. The first link takes you to a page that provides links to different healthcare program information. And the second link takes you to a page where you can sign up to receive email updates regarding DHS programs and services. Also, as I mentioned this morning, those temporary rules are still in place during the COVID-19 federal public health emergency, including maintenance of eligibility for existing members, postponement of renewals, suspension of premiums, suspension of the treatment needs question requirement for childless adults, and addition of the elderly, blind, and disabled population to presumptive eligibility. The information provided in the training today for BadgerCare Plus does not include these temporary rules. We wanted to provide you with the rules as they normally are and will be again, as far as we know, once the COVID-19 federal public health emergency ends. So BadgerCare Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant women, and childless adults ages 19 through 64 who are not receiving Medicare. BadgerCare Plus is a state and federal program that provides health coverage for low-income Wisconsin residents, and it is funded by Medicaid Title 19 and the Children's Health Insurance Program, CHIP, or Title 21. Most of the BadgerCare Plus populations are funded by Medicaid, but some higher income children and the prenatal program are funded by CHIP. CHIP is primarily a program covering low-income children's healthcare needs, and it also covers pregnant women who are enrolled in the BadgerCare Plus prenatal program. So first, let's take a look at the non-financial rules for BadgerCare Plus. Individuals must fall into one of these groups to qualify for BadgerCare Plus, and that, again, is a child age 0 through 18, a parent or caretaker relative who lives with and cares for a child age 0 through 18, and there's no age limit for the parent or caretaker relative that's caring for the child, a pregnant woman, again, no age limit, or a childless adult age 19 through 64 years old who is not receiving Medicare. A childless adult is a person age 19 through 64 years old who is not receiving Medicare and who does not have any dependent children younger than 19 years old who reside with him or her at least 40% of the time. And just a note, marital status has no effect on a person being a childless adult. The healthcare benefits for some children with higher household incomes are funded through the Children's Health Insurance Program, also known as CHIP. This includes children ages 1 to 5 with income above 191% of the federal poverty level, or FPL, and ages 6 to 18 with income above 156% of the FPL. As a result, these children are subject to different rules regarding backdated coverage and crowd-out policies. Additionally, to qualify for BadgerCare Plus, individuals must be a Wisconsin resident, physically present with an intent to continue residing in Wisconsin, be a U.S. citizen or qualifying immigrant, provide their Social Security number with some exceptions, and supply required information and verification within the required time frame. Finally, they must pay premiums if they are required and meet crowd-out rules when they apply. So those children with higher incomes may not qualify if they have access to or coverage through certain employer-sponsored health insurance. And some pregnant women who are immigrants or inmates may not qualify if they have other health insurance or have access to employer-sponsored health insurance. That's what crowd-out rules mean. And that brings us to our first poll question already. So hopefully you were paying attention to the first part of this presentation. What population does not qualify for BadgerCare Plus? Is that pregnant women, children under 19, parents and caretaker relatives living with children under 19, childless adults age 19 through 64, or people ages 19 to 64 who are receiving Medicare? Who does not qualify for BadgerCare Plus? We'll give you some time to answer that. So again, what population does not qualify for BadgerCare Plus? Pregnant women, children under 19, parents and caretaker relatives living with children under 19, childless adults ages 19 through 64, or people ages 19 to 64 who are receiving Medicare. Looks like a lot of you have answered. We'll maybe just give another 15 or 20 seconds. Okay, great job. It looks like most of you did answer correctly with E. People who are age 19 to 64 who are receiving Medicare are non-financially ineligible for BadgerCare Plus. Now they might be eligible for EBD Medicaid, but we're going to be talking about that tomorrow in our session. So, and yes, Ellie, we're going to take a look back before we move on to financial rules. We're going to talk about that crowd out rule. And I'm just going to go back a couple of screens. So crowd out rules are in place so that Medicaid doesn't crowd out employer-sponsored health insurance or other health insurance. So that's why children with higher incomes may not qualify for BadgerCare Plus if they have coverage or access to coverage through certain employer-sponsored health insurance. It's also why some pregnant women who are immigrants or inmates may not qualify if they have other health insurance or have access to employer-sponsored health insurance, because Medicaid doesn't want to crowd out those other health insurance programs. Does that answer your question? Awesome. Okay. All right. So let's go ahead and talk about, yeah, you're welcome, no problem. All right, let's talk about the financial rules for BadgerCare Plus. Financial eligibility is based on the household's expected monthly income. In some circumstances, annual income may also be considered. Assets are not considered when determining eligibility for BadgerCare Plus. So let's talk about those income limits. The federal poverty level, or FPL, is a federally determined income amount that is scaled based on household size and is usually adjusted every year. The FPL amounts seen here were effective February 1st, 2022, and can be found at the link shown on this slide. The income limit for adults is at or below 100% of the FPL for the appropriate household size. For children and pregnant women, the income limit is at or below 306% of the FPL for the appropriate household size. The chart on this page displays the income limits for BadgerCare Plus and then for advanced premium tax credits through the marketplace. So you can see that where the income limits cut off for BadgerCare Plus, those income limits for the advanced premium tax credits through the marketplace take over. Modified adjusted gross income, also known as MAGI. MAGI rules are used to determine household size and household income for BadgerCare Plus. MAGI rules are also used when determining eligibility for advanced premium tax credits, or APTCs, at the marketplace. So using MAGI rules, IM agencies determine how big the household is, also known as the household size, which household member's income is counted, and then what types of income and deductions are counted. And that's going to bring us to our second poll question. Question 2, the income limit for BadgerCare Plus for pregnant women is what % of the FPL? We'll give you some time to answer that. A, 100%, B, 150%, C, 200%, D, 256%, or E, 306%. What is the income limit for BadgerCare Plus for pregnant women? Give you some time to answer that. We'll give you 30 more seconds. I do see that there's a question in the question and answer. I just want to let you know that we will be talking about gap filling a little bit later in the presentation. So we'll be getting to that. We'll give you about 20 more seconds. All right. So great job. It looks like most of you did choose E, which is 306%. That is the income limit for BadgerCare Plus for pregnant women. Any questions about income limits before we move on to how to determine a household size? And like I said, we will be getting to gap filling a little bit later. So.
Hi, Nikki. I just want to jump in quickly and let people know the income limits for the advanced premium tax credits on the marketplace, which isn't something we've talked about a lot yet, but we will in future pre-licensing training sessions tomorrow and the day after, does go beyond 400% because of recent legislation that was passed, but we will address that in greater detail in later trainings. So just know the limit here does go beyond. There are tax credits for people who have incomes above 400% of the federal poverty level.
Thank you, Shannon. All right, let's move on to how the household size is determined for MAGI rules, which can be quite complex. So in some cases, the household size is based on who plans to file taxes and whom they plan to claim as tax dependents. These are called MAGI tax rules. In other cases, household size is based only on how the household members are related to each other. These are called MAGI relationship rules. As a result of these rules, different household members can have different household sizes. Additionally, for any pregnant woman included in a given household, the household size is increased by the number of babies she is expecting. Now, I just want to mention verification of pregnancy is not required unless the IM agency has information that contradicts the person's statement. So let's walk through some examples, and we're going to be using that handout titled Forming the MAGI Group. You should have received a PDF of that handout. It was also posted on the conference website. Shannon just mentioned it. She had it in the chat. So hopefully you were able to either print that handout or you have it available on a second screen because we are going to be going through the logic flow of that handout, and I am going to be asking you to go through the logic flow of that handout. All right. In most cases, if an adult in the household is planning to file taxes and is not being claimed as a tax dependent by anyone else, the household includes the tax filer, their spouse, and the tax dependents. So let's take a look at our first example. Joe and Liz are married and have two young sons, Matt and Leo. Liz is pregnant. Joe and Liz plan to file taxes jointly and claim both children as tax dependents. So using your handout, we'll use Joe as the target. So first we ask ourselves, is Joe planning to file taxes? And he is. So then we ask if he will be claimed by anyone else as a tax dependent, and he will not be claimed as anyone else by a tax dependent. So the answer to that question is no, which brings us to the next block, which is if no, include the target, which is Joe, the target's spouse, which is Liz, and all of the target's tax dependents, which is both children, right? Matt and Leo. So we're currently at a household size of 4. But then it goes on to say, if there's a pregnant woman in the group, include the number of expected babies and count only 1 baby if the number of expected babies is unknown. So we know Liz is pregnant, and we're going to assume she's pregnant with 1 baby. So Joe's household size would be 5. Joe, Liz, the expected baby, Matt, and Leo. Now, Liz's household size would also be 5 if we use her as the target. And if we look at one of the children as the target, we get the same result. So let's use Matt. Is Matt, as the child, expecting to file taxes? No, he's a child. So we see that if no, go to step 3. Step 3 asks, is anyone else claiming the target as a tax dependent? And the answer to that is yes, right? Joe and Liz are filing taxes and they're claiming both children as tax dependents. So then it says, if yes, is the target, which is the child, living in one household with both parents who are not filing taxes jointly? And we just discussed that. The answer is no, because the parents are filing taxes jointly. And then it says, if no, will the target be claimed by a parent living outside of this household? And again, that answer is no. The parents live inside this household. So then it says, if no, the target's Magi household group will be the same as his or her tax filers group. So Matt's the tax filer, and Joe and Liz, since they are filing jointly and claiming both children, Joe and Liz's household group, we said, was 5. So Matt's group, as well as Leo's, will also be 5, the same as their tax filer. Now, I want to mention that CARES Worker Web, or CWW, does determine these groups automatically for the IM worker, but it's based on the information communicated through the application, which is why it's really so important that household relationships are identified correctly when submitting applications. Any questions before we move on to some more scenarios? Okay. Moving on to example 2, we have Rich. Rich is a single adult that lives with and provides financial support to his elderly mother, Maggie. He plans to claim Maggie as a tax dependent. And we're going to let you practice on this one. So I'm going to give you a bit to look at your handout and see if you can identify Rich's household size on your own. And then I'll give you the answer. So I'll give you a couple of minutes to walk through that handout, and you can just jot it down or keep it in your mind what you think the answer will be. We're not doing a poll questions for this. Okay, so example 2, Rich is a single adult, lives with and provides financial support to his elderly mother, Maggie. He plans to claim Maggie as a tax dependent. Rich's household size is 2, Rich and his mother, Maggie, since he plans to claim her as a tax dependent. So we're going to walk through this one. Take a look at your handout. So we've got Rich. First, we ask if Rich is planning to file taxes, and we did say he is filing taxes. Then we ask if he's going to be claimed by anyone else as a tax dependent, and he will not be, so the answer is no. That brings us to the next block, which is if no, include the target, which is Rich, the target's spouse, and he doesn't have one, and all of the target's tax dependents, which is Maggie, right? So Rich's household is a size of 2, Rich and his mother, Maggie. Any questions before we move on to the next one? Okay. Now let's talk about relationship rules. In most cases, if an adult in the household is not planning to file taxes, the household includes the adult, their spouse, and their children under age 19 who are living with them. So let's take a look at example 3 together. Mike and Kelly are married and have a young daughter, Fiona. Mike and Kelly do not plan to file taxes. So using your handout, let's use Mike as the target. So first we ask ourselves if Mike is planning to file taxes, and he is not. Then we say, if no, go to step 3 and ask, is anyone else claiming Mike as a tax dependent? And the answer to that again is no, right? Nobody else is claiming Mike as a tax dependent. And then we see that if the answer to that is no, we go to step 4, which is to use relationship rules. And relationship rules tell us if they're living in the home, include the target spouse and his or her children under age 19. It then goes on to speak about if the target is under age 19 themselves, but we're going to stop there because Mike is over age 19. So that means Mike's household size is 3. Mike, his spouse, Kelly, and his daughter under age 19, Fiona. And Kelly's household size would be the same. Let's take a look at Fiona's household size, though, the child. So using our handout, Fiona is not expecting to file taxes. So we go to step 3. Nobody else is claiming her as a tax dependent. So that takes us to step 4, which again is relationship rules. And those tell us to count the target's spouse and his or her children under 19. Fiona's the child. She doesn't have a spouse or children. Moving on, though, we see that if the target is under age 19, which Fiona is, then we're going to include her parents and siblings under age 19 if they're living in the same household. So both of Fiona's parents are living in the household. She doesn't have any siblings. So her household size will be 3 as well. Any questions about relationship rules before we let you practice? Joe and Liz. Household size 5, FPL, 306%. When we figure out income, do we apply 8280 to the children and 2706 for Liz and Joe? So when you're looking at the children, you use the FPL for the children, that is correct, and the household size, all of the income of the people that we're counting in the household size. So 8280 would be what's applied to the children because they're a household size of 5. And 2706 would be what you apply for the adults because they are 100% of an FPL for a household size of 5 is 2706. In step 4, the relationship rules don't mention adult dependents. Can you speak to that? Step 4. Adult dependents that they're filing tax that they're claiming as tax dependents, you mean? In the relation. Okay, yes. Adult. If it's not, okay. I think I understand what you're saying. Let me pull up the, I don't have the, that up. So I'll bring that up here quick. All right. So in step 4 of the relationship rules, if no, go to step 4. Step 4, use relationship rules if they're living in the home, include the target spouse and his or her children under 19. That's it. It doesn't mention them because they're not included. They would only be included if we were looking at tax filing rules. Does that make sense? In the example I had with Maggie, it's not relationship rules because he's filing taxes. If he wasn't filing taxes and claiming Maggie, she would not be included in his household size because it would be relationship rules. Does that make sense? Just want to make sure we're understanding before I move on. Okay. All right. Kelly says okay. Is everybody else okay too? I just want to make sure. I don't want to move on until I know that. Okay.
Nikki,
all right.
Maybe we can do an example of if Rich and Maggie each were to apply and neither is filing taxes, what the household is. I think that would clarify for folks.
So if Rich was not filing taxes, he would be a household size of 1 because he does not have any children or a spouse in his home because it's relationship rules, right? And if Maggie were to apply, the scenario states Maggie's elderly. Elderly as defined by Medicaid rules is 65 or older. That would make her non-financially ineligible for BadgerCare Plus. But if she were under age 65, again, looking at relationship rules, we would take a look at, is anyone claiming her as a tax dependent? No, so it's relationship rules. Does she have a spouse or any children under age 19 living in the home? Nope. So she would be a household size of 1 if she was under 65 and not receiving Medicare. If she's 65 or older, which she is, she wouldn't be eligible for BadgerCare Plus, but we could look at EBD for her. Does that help everybody?
I think that's very helpful. And I think if we can do one and look at the chart together, it might help people, even though they have it separately. I think like going through it and pointing at step 1 with your mouse really helps people if that's possible to do one example that way.
Yeah, I think I have lost I presented it and now it's not available. Hold on just a second.
And I can present it if that's at all helpful to you.
No, I can bring it up again.
Okay.
That's no problem.
Great, thank you. This is, so everyone, these are great questions. This is often where it does get confusing and how do you form the household? So I'm glad everyone is engaged and asking good questions. So Thank you. And thank you, Nikki.
No problem. I am just gonna pull this off instead of, there we go. That'll be better. All right. And I just want to make sure we did Rich and Maggie and we did Mike. So now we were going to have you walk through one yourself. So example 4 is Lars and Laura. Lars and Laura are childless adults who live together but are not married. Laura is pregnant. Neither is filing taxes. So I'm going to give you a bit to look at your handout and I'm going to see if you can identify both Lars and Laura's household sizes, and then we can walk through it together. But I want to give you a bit to try and figure them out yourself first on your own. Okay, let me see if I can get this moved back over. Any difficulties with this today? There we go. Didn't want to move. All right. So first we're going to take a look at Lars, and just so you know, Lars is a household size of 1. So, oh, where the heck did it go? All right, and Laura is a household size of 2. I apologize. I think it's because it is a little difficult to do this while I'm presenting, but I want to be able to like use my arrow while I'm looking at it, or while we're looking at it together, and I won't be able to use my arrow, I don't think, unless I'm the one presenting. So let me bring it back up again. This is probably why it wasn't done that way. Let me just, okay. Sorry. There we go. Okay. So for Lars, is Lars expecting to file taxes? No. If no, go to step 3. So now we're down to step 3, and we ask, is anyone claiming Lars as a tax dependent? The answer to that is no. And it says, if no, go to step 4. If we go to step 4, it says use relationship rules. If they are living in the home, include the target spouse and his or her children under age 19. And he doesn't have a spouse or any children under age 19, so his household size is 1. And then for Laura, is Laura expecting to file taxes? The answer is no. If no, go to step 3. Is anyone else claiming Laura as a tax dependent? And the answer to that is no. So we go to step 4, and again, include the target spouse and his or her children under 19, and there aren't any. She's not married and she doesn't have any children under 19. So I thought there was another question up there about filing taxes. Not sure what happened to it.
Nikki, you are so perceptive. There was another question. I am working on a written response with a link to the IRS homepage with information about folks who don't have to file taxes.
Okay, sounds good. I do just want to say, when we say, are they expecting to file taxes? That's different than, so we only use tax filing rules if the person's planning to file taxes, right? So if they're not going to be filing taxes and claiming any dependents, then we don't use tax filing rules. Whether or not they file taxes is on them, and what happens to them if they don't file taxes and they were supposed to is totally different. So because they are not married and only live together, they would have separate cases / applications. You are correct. Yes, they would. Great job, Carlene. What happens when a family is divorced and the parents claim the child every other year? We're going to get to that. Good question. You guys are asking great questions. Laura is pregnant. In that case, shouldn't she has a dependent? Yes. That's why her household size is 2. Sorry, she doesn't have a spouse or any children under age 19, but she is pregnant. And so if there is a pregnant woman in the group, include the number of expected babies. And so we're just saying that she's only expecting 1 baby. And that is why her household size is 2. And I do have that, yeah, right there. So that her household size is 2. All right. We have more, don't worry. All right, I just want to say relationship rules are also used for children who are claimed as a tax dependent by someone other than their parent, children who are claimed as a tax dependent by a parent who lives outside of the home, and children who live with both parents, but those parents are not filing jointly. When relationship rules are used for children under age 19, Their household includes parents who are living with them and siblings under age 19 who are living with them. And we've already seen that when we looked at the other household members in our prior scenarios, but we're going to take a look at a few more. Example 5. Jaden, Rylan, and Warren are teenage brothers, and they are all under age 19 who live with their Aunt Sarah. Sarah plans to file taxes and claim all 3 brothers as tax dependents this year. So we're going to walk through this first one together. So first, Sarah is the target. And we're asking, is Sarah planning to file taxes? Yes. So we know we'll be using tax filing rules. If yes, is she going to be claimed by anyone else as a tax dependent? No, she's not being claimed as anyone else she's not being claimed by anyone else as a tax dependent. So if no, include the target, which is Sarah, her spouse, if living in the home or filing jointly, and she doesn't have a spouse in the home, filing jointly, and all the target's tax dependents. And if there's a pregnant woman, which there's not. So she has 3 tax dependents and her household size is 4. And then if we look at the children, we can use any of the 4 brothers as a target. So is the child planning to file taxes? No. So we'll go to step 3. Is anyone else claiming the target as a tax dependent? Yes. If yes, ask if the tax filer is the target's parent or spouse. No. So we'll go to step 4, which is relationship rules. And for relationship rules, we include the target spouse and his or her children. The target is a child, so they don't have a spouse or children. If the target is under age 19, which all of these children are, include his or her parents and siblings under age 19 if they're living in the same household. Now, the parents aren't living in the household, but the siblings are, right? So the siblings are all going to be included in their group together because we're using relationship rules. So all of the children will have household sizes of 3. What happens when a family is divorced and the parents claim the child we're going to get to that. When children live with both parents that are not married and not filing taxes, who counts child in their household? When children live with both parents that are not filing taxes, and are not married, we use relationship rules. So if they're living in the home, include the target spouse and his or her children under 19. If the target is under 19, include his or her parents and siblings under 19. So number of expected babies. I think we're going to have to come back to that one. I'm going to have to think through that one for more than what I have time for right now. Sorry. We'll come back to that if we have time at the end and take a look at what's in the BadgerCare Plus manual. But for right now, I think we're going to have to move on from that one. All right. All right. Now we have Jocelyn. Jocelyn is divorced and lives with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, plans to claim Maisie as a tax dependent this year. So that's that parents claiming the child every other year. So I'm going to give you a bit to look at your handout and see if you can identify both Jocelyn and Maisie's household sizes, and then I will give you the answer and we'll walk through them. So go ahead and take a couple minutes to look at that and see if you can determine Jocelyn and Maisie's household sizes. Give you just another minute here. Okay, let's take a look at these and walk through them together. So Jocelyn is going to be a household size of 1 because she's a tax filer with no tax dependents. And Chris, because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie, and Maisie's household size is 2, herself and her mother. So let's walk through those together. We've got Jocelyn. Is she expecting to file taxes? Yes. She's not being claimed by anyone else as a tax dependent, so we include her, her spouse, and her tax dependents living with her. No, and all the target's tax dependents, and she's not pregnant. So she does not have any tax dependents because she is not claiming Maisie this year. So her household size is 1. Then if we look at Maisie, is Maisie filing taxes? Nope. So we go to step 3. Step 3, is anyone else claiming Maisie as a tax dependent? And the answer to that is yes. If yes, is the tax filer in the targets? Is the tax filer, if the tax filer is the target's parent or spouse, and the tax filer is the target's parent or spouse, so that is yes. If yes, ask if the target lives in the household with both parents who are not filing jointly. And she does not live in a household with both parents who are not filing jointly. And if no, ask if the target would be claimed by a parent living outside of this household. And that is yes, right? She's being claimed by her parent living outside of the household. So if yes, go to step 4, which is relationship rules, and include the spouse and children. She's a child herself. So she's under age 19, include his or her parents or siblings under age 19 if they're living in the same household. And she does have a parent living in the same household. So her household size, the child's household size, is 2. Okay. And I'm getting, okay. Awesome. Okay. Next, our last example. Dan and Jackie live together but aren't married. Oh, here we go. Oh, but he's planning to file taxes. They have 10-year-old twins, Sadie and Lily. Dan plans to file taxes and claim both children as dependents. Jackie also plans to file taxes. So I'm going to give you a bit to look at your handout and see if you can identify Dan's household size, Jackie's household size, and the two children's household sizes. So go ahead and take a few minutes to look at your handout and see if you can determine their household sizes using that handout.
Hi, all. I just want to address the question that came in. I'm confused with jumping from adult to child. So we're doing this exercise for each person in each household scenario. So first you take Dan, and Dan in this example, Dan is the target, right? That's what we call it. Choose a target. So Dan's the target, and you work through the logic for Dan and you get to Dan's household size. Okay. Then next you would do Jackie. Jackie is the target, and you work through the scenario and you get to her household size. And then you get to the children, Sadie and Lily. So take one child, say Sadie. And because Dan is claiming both, the logic is going to work the same for Sadie and Lily, and you work through the logic for the children. And one takeaway of doing all these scenarios is that depending on tax filing considerations, different people in the same household can have different household sizes. So I hope that clarifies things a little bit. It's really great to see all the discussion and questions here because this is important. And also, I just want you all to extend some grace to yourselves. This is new information and it is complex.
Very.
And so we will address as many questions as we can on this topic. And then also just know, like, this is something you can go back and you can repeat this exercise. And sometimes it does take a little bit to sink in. And as enrollment assisters or helping people to connect with coverage, this is important to understand, but also know you're doing a three-way call with the income maintenance agency. If you're helping somebody with an application, like, they will work through this and help arrive, and they will form the household and make the determination, not you.
Right.
So
and
this
actually
is really helpful because you want to set people up to apply for the right programs, right? And look at their how their FPL will be calculated. But when it gets complex and you're having trouble figuring out, okay, how do these rules apply? You can always do the application and then take the next step from there. So if you do an application and it turns out somebody's over income for that program, and they should be going to the healthcare.gov, the federally facilitated marketplace instead of Medicaid. Once you work through that, you can move them to the next step. There is no harm in submitting the information and then going from there.
Yeah, it is very complex. And like I said earlier, CARES Worker Web actually determines these household sizes automatically based on the rules and how the information is entered into CARES Worker Web. So what those household relationships are, which is why that information is so important to have correct on the application. So that's the most important piece, is that the application and the information that's being given to the IM agency is correct as far as how people are related to one another, if they're related to one another, if someone's filing taxes, and who they're planning to claim as tax dependents. So those are definitely the most important things. And we will get through, I think this is our last example for this one, and we're probably going to hold off on all other household examples. They're getting very complex as far as pregnant dependents and unborn grandchild and things like that that are very complex and really will depend on the situation. Like, what if the adult is an EBD member? What if they're not caring for? What if, you know, there's a lot of different things that can go into household sizes. So we're probably not going to have time to go through all the different types of scenarios there are, but we will go through this last one together. We'll have to move on. And then if we have time, we can come back at the end too. I'm happy to do that if we have time. All right, let's take a look at Dan and Jackie and what you came up with. So for Dan, using tax rules, Dan's household size is 3 because he's a tax filer with 2 tax dependents. Using tax rules, Jackie's household size is 1 because she's a tax filer with no dependents. And for the twins, relationship rules are used because their parents are living together but not filing jointly. So each child's household size is 4 because it includes the child, her sister, and their 2 parents. So let's take a look at all of those. I think this is, okay. I'm just going to make this a little bigger and see if we can keep this up on our screen. Okay, so first we have Dan. Dan is filing taxes, so that's a yes. So he's not claimed by anyone else as a tax dependent. That's a no. So we include Dan, his spouse, if the spouse is living in the home, and all of his tax dependents. So we've got Dan and his spouse, he's not married, and all of his tax dependents, and he's claiming both children, so his household size is 3. Then we move on to Jackie. For Jackie, is Jackie filing taxes? Yes. So is she claimed by anyone else as a tax dependent? No. So tax filing rules are used. And we include Jackie, her spouse, if living in the home or filing jointly and she's not married, and all of her tax dependents, and she doesn't have any. So her household size is 1. And then for the twins, relationship rules are used because they're not filing taxes, right? The answer to that is no. Go to step 3. Is anyone else claiming them as tax dependents? And that is yes. If yes, is the tax filer, if yes, ask if the tax filer is the target's parent or spouse, and if the tax filer is their parent or spouse. So if yes, ask if the target lives in the household with both parents who are not filing taxes jointly. And that is a yes. So we go to step 4. And step 4 is relationship rules. And if for relationship rules, we include if they're living in the home, their spouse, kids don't have the spouse. They don't have any children. They're both under age 19. So we include their parents and siblings if they're living in the same household. So since they are siblings and both parents do live in the household, each child has a household size of 4. If Dan and Jackie apply in May during the year when Jackie claimed the twins, during the year when Jackie claimed the twins, we don't say that Jackie's planning to claim the twins every other year. If Dan and Jackie apply in May during the year when Jackie claimed the twins, does only Dan get to claim the twins because he's planning on claiming them next year? No, we're looking at who plans to claim them the year that they're applying. So Dan is claiming them this year. So we will be looking at the household size as it was on, of 3. And maybe I'm just confused by the question, but.
I think the question is trying to get at tax years being, right, you file taxes after the year has occurred.
Yeah, Nikki was right.
Yeah. So it's based on who's claiming them this year, the year that you're applying. That's what the IM worker will be asking, and that's what's on that page that they're filling out, is who's claiming these kids in this year. Do you have any tax dependents you're claiming for this year, the year you're applying?
Excellent. I think it just people get confused because of how the tax years fall in
yeah, I get it.
And I think the worker, and also I think CACs and navigators usually use the terminology of who will be claiming you on 2022's tax year, because that's what you're worried about in this year. And then they say it for 2023, because it does get confusing, because we tend to file taxes in 2023 for 2022. So that might be something that you all who are taking this training can use that as a talking point when you're speaking to clients, so that you can better explain.
Thanks, Masiel. All right, more about household size. So to wrap up our conversation about household size, these are just a few additional notes. Tax dependents can be included in someone's household size even if they're living outside of the home or are deceased. Tax filers can claim a deceased child as a tax dependent or a deceased spouse as a tax co-filer in the years they pass, and they would be included in the tax filer's group size. Spouses must always be included unless they're living separately and filing taxes separately. To be considered to be living with a parent, a child under age 19 must be in the parent's home at least 40% of the time. If parents are divorced, only one parent can claim the child as a tax dependent each year. And then tax rules are based on how the person plans to file taxes for the current tax year. More information about households can be found in BadgerCare Plus Eligibility Handbook Chapter 2.3, and the link to that handbook is shown on this slide. And the flow chart we provided as a handout today can also be found in the handbook in Chapter 2.3.3. So there's a lot more information about household sizes in the actual handbook. We don't have time to go over all of those rules, but we are, like I said, we can come back to some of that if we have time at the end. We're kind of running, we're already at 11:30. So, okay. It is time for our next poll question. So question 3, relationship rules are not used for the indicated individual in which scenario. So households may have some people, like we talked about, under tax rules and other people under relationship rules. So really for this question, only think about if tax rules or relationship rules are used for the specific individual described in the scenario. So the question again is, relationship rules are not used for the indicated individual in which scenario? Relationship rules are not used for an adult in the household who is planning to file taxes and is not being claimed as a tax dependent, would be A. Relationship rules are not used for an adult in the household who is not planning to file taxes. Is that true? C is a child who is claimed as a tax dependent by a parent who lives outside of the home. And D is a child who lives with both parents, but those parents are not filing jointly. So relationship rules are not used for which individual, for which scenario. I'll give you some time to think about that one. Give you just a little bit longer, I think, to answer this one, then we're going to have to move on. About another 30 seconds or so. Okay, so the correct answer is A. It looks like a majority of people did choose that one. When an adult in the household is planning to file taxes and is not being claimed as a dependent, tax rules will be used to determine household size, not relationship rules. All other individuals described would use relationship rules. Okay. And I see that there's a lot of questions in here still about household size. Like I said, we're going to have to move on from household size, but we can come back to these later if we have time. So, all right. Next, let's talk about whose income is counted. So, in general, all household members' income is counted. However, if a household member is a child or tax dependent of another household member, his or her income is only counted if he or she is expected to be required to file a tax return for the current year. So that's why I kind of made that distinction earlier about expecting to file taxes, because household size is based on what that household is planning to do as far as filing taxes. Income, when we're looking at whose income is counted, and this rule around expected to file, that is different. Expected to be required to file taxes includes children or tax dependents who expect to have more than $12,950 in earned income or more than $1,150 in other income for the tax year. And you may want to jot those facts down for our example. So expected to be required includes children or tax dependents who expect to have more than $12,950 in earned income or more than $1,150 in other income for the tax year. For the expected to be required rule for children or tax dependents, other income does not include child support, Social Security, supplemental security income, also known as SSI, workers' compensation, veterans benefits, money from other persons, or educational aid. So if the child or tax dependent is receiving these types of incomes, they're not counted under this rule. Now, these thresholds are updated annually, and the thresholds on this page were effective January of 2022. So let's talk about this in the context of an example. We're going to go back to example 6. Jocelyn is divorced, lives with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, who doesn't live with them, is claiming Maisie as a tax dependent. So we said using tax rules, Jocelyn's household size is 1 because she's a tax filer with no tax dependents. And because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie. And Maisie's household size is 2, herself and her mother. So you might want to jot down that too. Jocelyn's household size is 1, Maisie's household size is 2. Now, Maisie has a part-time job at McDonald's, and she's earning approximately $400 a month. Might want to jot that down as well. Maisie's earning approximately $400 a month. Jocelyn's household size is 1, Maisie's household size is 2, herself and Jocelyn. So for Jocelyn's eligibility, which again is tax filing rules, and she's the only household member, only her income is going to be counted for her eligibility. Tax filing rules are used. For Maisie's eligibility, her mother's income would be counted under relationship rules, but since Maisie is the child of another household member, her income is only counted in her eligibility determination if she's expected to be required to file taxes. So let's take a look at that. Maisie only earns approximately $400 a month, so she expects to earn approximately $4,800 this year from her job, and she's below the expected to be required to file threshold, which we said was currently $12,950 in earned income. So her income is not counted in her eligibility determination. And I want to mention it's not counted even if she chooses to file taxes because she's not expected to file. The fact that she's not expected to be required to file them supersedes whether or not she chooses to file taxes as a child. Therefore, only Jocelyn's income then is going to be counted for Maisie's eligibility. Now, if Maisie were to earn $1,200 a month or $14,400 a year, she'd be above that threshold, and her income would be counted for her eligibility in addition to her mom's income. But her income still wouldn't be counted for Jocelyn's because Jocelyn is a household of 1 under tax filing rules, just herself. Questions about that scenario? That one is a little more straightforward when we're talking about expected to be required to file. And the application, the mail-in application does ask that question specifically. Are they expected to be required to file? Are they expecting to earn income more than so much per month or year? And then that's also what's on the CARES Worker web page that the IM worker is filling out as well. So most taxable income is counted for BadgerCare Plus. This includes, but is not limited to, taxable gross earnings from a job, taxable earnings from self-employment, unemployment compensation, financial aid if used for living expenses, taxable retirement, pension and annuities, and interest and dividends. I want to point out that Social Security income is usually not taxable, but it is counted for BadgerCare Plus. unless it's income of a child or tax dependent under that special expected to be required to file rule. So that's the income that is generally counted. Let's take a look at income that's generally not counted. So examples of common types of income that are not counted for BadgerCare Plus include child support, alimony, spousal support, or maintenance payments received under separation or divorce agreements completed after January 1st of 2019. Supplemental security income, also known as SSI payments, gifts or other money from another person, workers' compensation, and veterans benefits. A full list of income that's not counted is available in the BadgerCare Plus Eligibility Handbook, Chapter 16.2. So, any questions about income amounts that are income types that are generally counted, income types that are generally not counted? And then before we move on to deductions, because then we also have deductions. Okay. A deduction is an amount that can be subtracted from the amount of income used to determine eligibility. Pre-tax paycheck deductions are allowed as BadgerCare Plus income deductions. An example of that would be pre-tax contributions to a health savings account. Tax deductions listed on IRS Schedule 1, Form 1040 are also allowed. Examples of those deductions are student loan interest paid, higher education expenses, and self-employment tax. Itemized deductions like mortgage interest and charitable contributions are not allowed. And a full list of income deductions can be found in the BadgerCare Plus Handbook, Chapter 16.3. That brings us to another poll question. What type of income is not counted for BadgerCare Plus? Is it A, Social Security payments, B, child support payments, C, taxable earnings from self-employment, D, unemployment compensation, or E, taxable gross earnings from a job? Which type of income is not counted for BadgerCare Plus? And we're just going to give you probably 10 or 15 more seconds. We've still got a lot of content to get through before the end, and we've got 10 minutes left. So we spent a little too much time on household size. All right. Which type of income is not counted for BadgerCare Plus? I'm going to go ahead and pull the results up. The answer is B. Child support payments are not counted as income when determining BadgerCare Plus eligibility. All right, so now we're going to talk about some special situations, which include presumptive eligibility, also known as express enrollment, gap filling, former foster care youth, income extensions, continuous eligibility for pregnant women, continuous eligibility for newborns, BadgerCare Plus emergency services, BadgerCare Plus prenatal program, family planning only services, and premiums. A lot of information to get through here. All right, presumptive eligibility, or PE, is also known as express enrollment, or EE. It can also be known as temporary enrollment, or TE. Honestly, we're not trying to confuse anybody. It's just that different partners sometimes call programs by different names. And we just want to make sure you know that whether you hear it called PE, EE, or TE, they're all talking about the same program that provides this express temporary enrollment based on the presumption of eligibility established from household and financial information provided by the applicant to the partner, provider, or qualified hospital. This would be a streamlined online application for BadgerCare Plus or family planning only services that's facilitated through those partners, providers, and or qualified hospitals. Presumptive eligibility provides up to 60 days of benefits before the individual must apply for ongoing benefits through the Income Maintenance Agency. And presumptive eligibility is available to children, pregnant women, and adults under age 65. However, as mentioned earlier, presumptive eligibility has also been temporarily extended to elderly, blind, and disabled adults during the COVID-19 public health emergency. So presumptive eligibility is done through those partners, providers, and other agencies based on the information the member gives them, and they can be enrolled in up to 60 days of benefits before they have to do the actual application through the agency. Next, we have information about gap filling. In most cases, eligibility for BadgerCare Plus is based on monthly income. At the marketplace, eligibility for advanced premium tax credits or APTCs is based on expected annual income. Only people with households with income above 100% of the FPL are eligible for APTCs. So someone could be ineligible for BadgerCare Plus because of high monthly income, but then be also ineligible for APTCs because of low annual income. So here's an example. James is unemployed for most of 2022, but he starts a job in October earning $3,000 a month. As a single adult, he's well above the monthly income limit of $1,132 for BadgerCare Plus, but his annual income is only going to be $9,000, which is below 100% of the FPL and would make him ineligible for those advanced premium tax credits. In situations like these, individuals can enroll in BadgerCare Plus through the end of the calendar year based on their annual income. And this type of enrollment is called gap filling. Gap filling enrollment can happen when the marketplace sends an application to Wisconsin that's been identified as a possible gap filling situation. It can happen when the applicant has a letter from the marketplace stating that they may be eligible under gap filling rules. It can happen when an IM agency identifies that an applicant or member appears to be eligible under gap filling rules. And an applicant or member can request a determination based on gap filling rules. Even if a person is tested under gap filling rules, they might not be eligible for BadgerCare Plus. Now, in most cases, that would be because they didn't report all of their income when applying at the marketplace. Someone denied for gap filling can provide updated income information to the marketplace or appeal their marketplace decision. So I know you wanted more information about gap filling, and that's the information we're going to have time to give you right now. I'm going to move on to the other special situations, but we can come back to questions about gap filling later if we have time. Moving on to former foster care youth. Former foster care youths include anyone who was in foster care, subsidized guardianship, or court-ordered kinship care when they turned 18. And for this population, no income limit is applied when determining their BadgerCare Plus eligibility until they turn 26. Keep in mind that their income information may still be needed if they're included in another household member's assistance group, though. So that's why potentially a former foster care youth would still have a request for verification of their income. Earned income extensions. When a parent or caretaker relative's income goes above 100% of the FPL due to increased earnings, their eligibility and their children's eligibility is extended by 12 months. The The extension continues as long as the household continues to meet basic non-financial rules, and there's no income limit during the extension period. However, if the household's verified income goes below 100% FPL during that extension, the household then goes back to normal BadgerCare Plus. There'll no longer be an extension. This is also known as transitional medical assistance. There are other reasons outside of income considerations when someone's eligibility may be extended. And the individuals that fall into these categories are also considered to have continuous eligibility. And they include pregnant women who become eligible for BadgerCare Plus. These pregnant women stay eligible through the end of their pregnancy, and they are also eligible during a postpartum period that lasts until the end of the month in which the 60th day after the pregnancy occurs. And babies who are born to a mother enrolled in BadgerCare Plus or Medicaid. So mom must be receiving BadgerCare Plus or Medicaid at the time of the child's birth for this continuous eligibility to apply to the baby. And these babies will stay eligible for BadgerCare Plus until they turn 13 months old. These eligibility periods for pregnant women and newborns continue even if the household income goes over the program's income limit. Moving on to BadgerCare Plus emergency services. This is a limited benefit BadgerCare Plus program that covers services needed for the treatment of an emergency medical condition when certain individuals meet all BadgerCare Plus program rules except qualifying immigration status and having or applying for a Social Security number. BadgerCare Plus emergency services is not available for childless adults, which are those adults age 19 through 64 who are not living with and caring for a child under age 19. BadgerCare Plus emergency services is not available for children with higher incomes or for women enrolled in the BadgerCare Plus prenatal program, which we're going to talk about next. While emergency service applications are processed by IM agencies, it's not the responsibility of the IM agency to determine if the applicant's condition is or was an emergency condition and reimbursable under BadgerCare Plus emergency services. It is the IM agency's responsibility to manually determine if the non-qualifying immigrant meets all eligibility requirements during the dates of service and certify them if he or she is eligible for emergency services. Medical providers who have treated a non-qualifying immigrant for emergency services may complete the certification of emergency for non-US citizenship form. That form is F01162 to verify that the services provided were to treat an emergency medical condition, and the patient can then provide that form to the local IM agency when applying for assistance, although the form is not required. Additionally, a provider's certification of emergency by completing that form still does not guarantee reimbursement. When the medical provider submits claims for emergency medical services to the fiscal agent determines if a condition is an emergency medical condition covered by emergency services. More information about emergency services can be found at the link shown on this slide. And I believe that link is going to be put into the chat box as well. BadgerCare Plus prenatal eligibility is different than regular BadgerCare Plus for pregnant women, which we discussed earlier. BadgerCare Plus prenatal is available to pregnant women who meet all other rules for BadgerCare Plus, but do not qualify because they do not have a qualifying immigration status or are inmates of a public institution. Women are not eligible for BadgerCare Plus prenatal if they are currently covered by any HIPAA health insurance policy. They also may not have current or past access to an employer-sponsored health insurance plan in which the employer pays at least 80% of the premium. Women enrolled in BadgerCare Plus prenatal do not qualify for backdated eligibility, and the continuous eligibility for pregnant women does not apply to women enrolled in BadgerCare Plus prenatal. Family planning only services are a limited benefit plan for women and men of childbearing or reproductive age. It covers certain services and supplies related to family planning. The income limit for family planning only services, or FPOS, is 306% of the FPL. The household size for this is always 1, and only the individual's own income is counted. Finally, we're going to talk about premiums, and we'll start with children's premiums. Children with household income above 201% of the FPL must pay premiums, except for pregnant minors, former foster care youth. Children who have met a BadgerCare Plus deductible won't have premiums during the remainder of their deductible period. Children in a BadgerCare Plus extension. All children under age 1, including continuously eligible newborns, and American Indian or Alaskan Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services. Failure to pay required premiums results in a 3-month period of ineligibility called a restrictive re-enrollment period, or RRP, for the child, but individuals can re-enroll during their RRP by paying the owed premiums. As a reminder, BadgerCare Plus premiums are currently suspended until after the federal public health emergency ends. Premiums for childless adults. Childless adults with income 50 to 100% of the FPL must pay premiums, except for American Indian or Alaskan Native tribal members, the son or daughter of tribal members, grandson or granddaughter of tribal member, or anyone otherwise eligible to receive Indian health services. Individuals who are disabled, individuals who have resided in or expected to be residing in an institution for at least 30 days, individuals who are homeless or have been homeless in the last 12 months, and individuals who are deceased. Childless adults can complete a health survey that may reduce their premium, and they're required to complete a treatment needs question that asks about substance use. As a reminder, though, premiums for childless adults are currently suspended. And yes, we are supposed to be done at 12 for the person that typed that in there. That brings us to our last poll question. If you have time to stay for the last poll question, that would be wonderful. If you don't, that's understood. Which of the following is not a scenario? Which gap filling determinations would be done? A, an applicant or member requests a determination based on gap filling rules. B, an IM agency identifies that an applicant or member appears to be eligible under gap filling rules. C, the Disability Determination Bureau determines that the applicant or member appears to be eligible under gap filling rules. D, the marketplace sends an application to Wisconsin that has been identified as a possible gap filling situation. Or E, the applicant has a letter from the marketplace stating that they may be eligible under gap filling rules. Whew. All right, we're going to give you just a little bit, not long, to answer that question because we're already over time, and I apologize. And you might not have had time to write down all that information or even digest all of that information about gap filling rules in the amount of time we had left in this presentation. I apologize for having to go through this so quickly at the end. We are going to probably need to note for our next presentation that we just can't spend that much time on household sizes.
You're doing great. Thank you for those who have stuck with us.
Yes.
That determining household piece is always a real bear. So just answer this question if you can, please.
Yes.
We're at about half of the people participating. This is the end. We're wrapping up. As you're answering that question, just know we'll be back tomorrow. Nikki will be our first presenter on elderly, blind, and disabled Medicaid programs. And then the second presentation will be from the Office of the Commissioner of Insurance. So we'll do a final call for answering this question, and then Nikki can give the response.
Yeah.
So
all right.
5, 4, 3, 2, 1, go ahead.
The answer is C. The DDB is not involved in determining if a person may be eligible for BadgerCare Plus under gap filling rules. So some additional resources, your online policy resources, such as policy manuals, handbooks, forms, and directories. We can put these in the chat. You should have the slide handout from this as well, so you can go back and take a look at those later. Any other questions we'll have to get back to you on, I apologize. So any new questions that we aren't able to get back to you on can be sent to the Forward Health Partner inbox. I do thank you for your time and attention. I do apologize for having to rush at the end. I will be back tomorrow. Hopefully you're not sick of me yet. And I'll be back for EBD tomorrow. So
that's
thank
great.
you all so
Thank you.
much.
Thank you so much, Nikki. Thank you so much, Masiel. It was a lot of information. Know that we recorded it and it will be posted. The slide decks are also posted on Covering Wisconsin's Enrollment Conference webpage. So you can find all the information there and you can review it at your leisure. The recordings will take a little bit of time to post, but just know that they are coming, but the slide decks are there now. So thank you again. Thank you all for joining. We'll see you back tomorrow morning at 9 a.m. For a continuation of the pre-licensing training. And again, that will go from 9 to noon tomorrow. You will get another email in your inbox, or you can go to the Covering Wisconsin conference homepage and you can get into the training that way. I will pull that menu page one more time and put it at the bottom of the chat for everyone. So if you don't get that email, if you're having trouble getting in, just go to Covering Wisconsin, which is covering and then wi.org/conference menu, and you will be able to get into tomorrow's training. So thanks again, Nikki. Thanks, Masiel. Your time and expertise is greatly appreciated. We'll see everyone tomorrow.